Well, so many people are getting really sick from this virus. Texas hit another record high for hospitalizations yesterday. The state is reporting 9,600 hospitalizations, and that's reflected here in our area as well, where doctors and nurses really have treated more than 1,800 patients. We can reel off numbers all day long, but we got to put this in perspective, okay? From someone on the front line. So joining us now, Baylor Scott and White Health's Dr. David Winter. And we have seen a recent jump in deaths across the state, Dr. Winter. So, I mean, I could ask you how concerning this is, but of course any death is concerning. Can you help us to digest what this actually means?
Well, there's no question that cases are on the rise, the hospitalizations are on the rise, the deaths are on the rise. It's really distressing because it doesn't have to happen. It's not happening all around the world. It's not happening in other parts of the country. It's the fact we aren't distancing, wearing masks, and disinfecting enough. This virus has always been there. It's been at a low level. Now that we've gotten out of our homes, we can still prevent this from spreading if we just do the right thing. So that's the main message. It's going to continue to go up, and we're going to get into a crisis mode if we don't start taking care of ourselves and helping to do our part to prevent the spread of this virus.
So I'm wondering how you guys at Baylor are doing in terms of bed space, capacity, but also staffing. And then what are you seeing? Are people coming in with more mild symptoms, or are they coming in with an extremely, violent experience with this virus?
Well, first of all, we have plenty of capacity now. We've seen a big increase the last week. So if this continues to go up, that may not be true, but we're making plans to expand our beds for sick people with coronavirus. So far we're good, and we're coordinating with the Dallas-Fort Worth Hospital Council, so we're all good pretty much right now. But we worry about this if it continues to spread. Yeah, we're seeing lots of cases, mild cases, moderate cases. We're seeing the whole continuum right now. More and more young people are coming down with the disease. We're seeing lots of that. Most of those folks aren't that sick, but some are. Young folks are not bulletproof. This 20-year-old girl with no other diseases, no other comorbidities as we call them, she died several days ago in the Dallas area. So young folks are not immune. We need to get that message out.
Let me ask you about testing, because I have a friend who texted me and said, Sonia, my friend and I both got tested, on a Thursday and Friday. He got his results back and I did not. We went to the same location. So people are waiting a long time for these test results. What is the explanation for that, and what should they be doing while they wait?
That's a very good question. So several weeks ago, we had plenty of testing available, but as more and more folks have gotten sick, and more folks worry about it with other symptoms, we're being overrun. The whole community is being overrun with testing problems right now. There's only so many tests you can do in an hour, and we don't have enough machines, enough tests, enough employees right now. We're encouraging folks with mild symptoms. The main thing is we're not going to treat you with anything. You need to stay home and quarantine. If you think you've been exposed, stay home and quarantine. If you're really sick enough that you might need to be hospitalized, you should go to an urgent care center or one of the places that is testing or an emergency department, because you need to be seen and get into a hospital perhaps right away. But for milder cases, we're not going to do anything anyway. So folks are going to have to be patient. We're trying to get more testing equipment, more testing employees. But right now, there's a rush to the bank on testing. So
stay at home, or, are you allowed to go out and grab a coffee if you're wearing a mask and you are, you have this active virus that's shedding, as we call it, right? Because I have another friend, I have a lot of friends with this thing now, who has retested and tested positive again, right, after 14 days. And I know you and I have talked about this before, the importance of retesting, and how much can you really go out into the community if you're testing positive for COVID-19?
Yeah, if you have the virus, you should not be getting out. You should quarantine yourself. Do the community a favor. This virus is going to continue to spread as long as it's in somebody's body and goes to somebody else's body and somebody else's body. So please stay home. If you're really sick, talk to your doctor about what you need to do, but there's not really any good treatment right now for the COVID-19 virus. There's stay home, rest. You get really sick, we can handle that in different ways in the hospital. But if you have the virus or think you do, please stay home. We don't need to spread this virus anymore. We need to dampen it down like they did in New York City and most other countries in the world. We're the exception because it's going up in our state.
And get retested if you can?
Yes. Well, it just, if you are well and if you were tested and are positive and you get well, is another test important? Not necessarily. It depends on your work environment. It depends on what you're doing. But we have a shortage of tests right now, Sonia, so it's a big problem getting all the testing done that we would like to.
Yeah. Okay, Dr. Winter, thank you so much. Thanks for your time. We appreciate it. Stay safe.